Hello everyone, this is Dr. David Pascal, and many of you know that I am a chiropractor in Cary, North Carolina, specializing in the treatment of CRPS, complex regional pain syndrome. And today I want to talk about the impact of cranial nerves on CRPS. Well, our nervous system is very interesting, and it is kind of divided into parts. What is known as the central nervous system consists of the brain stem, and the spinal cord. And coming directly off of the brain are 12 pairs of nerves that stay primarily in the head. Almost all of them stay primarily in the head. And those are called cranial nerves, which is kind of funny because the nerves that come off the spine are called spinal nerves. So maybe the nerves that come off your brain should be brainal nerves, but they don't do that. They didn't consult me on names. They call them cranial nerves, maybe because of your cranium, which is your skull, fancy word for skull. In any case, we have 12 pairs of nerves. They are pairs because for each pair, one goes to the left side of the brain and the other goes to the right side of the brain. Primarily. So cranial nerve number one is olfaction, and that is your sense of smell. And for the purpose of today's talk, I want to list out all the nerves and what their basic function is, and then how they can kind of be impacting. Cranial nerve number two is the optic nerve, so that carries the light from the back of our eye into our brain. Cranial nerve number three is primarily responsible for accommodation, which is the ability to focus near and far. Cranial nerves 3, 4, and 6, 4 being the trochlear nerve and 6 being the abducens, are all responsible for eye movement. So looking left, looking right, looking up, looking down, looking diagonally up to the left and diagonally up to the right, diagonally down to the left, diagonally down to the right. Cranial nerve number 5 has two major functions. One is sensation, and it has 3 branches. So sensation to your forehead, sensation to your cheeks, and then sensation to your chin. And then cranial nerve 5 also has the muscle control to your jaw. Cranial nerve number 7 is the facial nerve, and that is responsible for for muscle control. So raising your eyebrows up and down, closing your eyes tightly, smiling, that's all the facial nerve. And then it's for taste on the anterior, meaning the front 2/3 of the tongue. And it also does sensation like the ear canal and your cornea. Cranial nerve number 8 is our auditory nerve, and it does 2 things. One is for hearing, the other is for balance. Cranial nerve 9 is our hypoglossal nerve, and 9 is glossopharyngeal, and it is often paired with 10, which is our vagus nerve. But the glossopharyngeal is responsible for swallowing food. Cranial nerve number 10 is the nerve you are all probably most familiar with, and that is our vagus nerve. It is the longest nerve in the body. Vagus is Latin for wanderer, because that nerve kind of goes all over the body, basically to all of our organs and glands, to mediate what I like to call the idling speed of that gland, make sure it's not hyper-functioning or hypo-functioning. 10 is the spinal accessory nerve, which goes to our trap muscles, and cranial nerve 12 is for our tongue, our hypoglossal, so being able to stick your tongue out straight to the left or to the right, retract your tongue. That is all cranial nerve number 12. Now, when we look at nerve function, and it doesn't matter if it is a nerve coming off the brain, like a cranial nerve, or a nerve out in your body, what we call peripheral nerves, like the nerves that are going to a muscle in your arm or to the skin on your hand, for sensation. All of those nerves have basically on-off switches. And if the main function that that nerve is going to is let's say, to turn it on. So then it has, if you send a positive signal, an excitatory signal down the nerve, it'll make whatever the target is turn on. But and then the opposite of that would be an inhibitory signal. So you can send a signal down the nerve and it will stop that thing from firing. But if the end tissue is an opposite thing, right? So a positive effect would be to turn it off. Then if you excite a negative, you get a negative. If you stop a negative, you get a positive. So it can get a little confusing there, but I was trying not to go down that road. I see that I did, so I apologize if that is confusing. Be glad to clear that up later. But let's get into what happens with a specific nerve and how it can be damaged. Most nerves that are being damaged off the brain are not getting true cellular damage. There's not an actual nerve that's being cut or the cells of the nerves being destroyed. What is primarily happening is that nerve, the signal going down that nerve is being turned off, and it's usually being turned off as a protective mechanism. So if you have some type of trauma and then the brain decides to turn off olfaction, then, which is cranial nerve number 1, then you won't be able to smell. Same thing with the optic nerve. Someone might lose vision if that optic nerve is being turned off. It can also lose vision if that nerve is cut. But I see many people that come in, they have vision problems, and they don't have a true cellular damage. They have an excitation of the inhibitory signal, so an inhibition. That nerve is basically turned off. Just like if you go to your light switch and the light is on and you turn your light off, you didn't break the light bulb, you didn't cut the nerves, you just turned off the signal. And this happens a lot with any type of long-term brain inflammation or some type of brain trauma, and it can even be, doesn't have to be a physical thing, it can be an emotional thing. So one of the first things that I do when patients with CRPS come to me is I evaluate the function of all of their cranial nerves. So we have them smell something and hear something and test their balance and run through all of those cranial nerves. And quite often we will find dysfunction. Well, if we find, let's say, vagus nerve might be hyperactive, the way that we can treat that is I use a technique where we stimulate vagus nerve. In this case, we know, for example, the vagus nerve innervates the sensation for the back of the throat. I can have a patient drink a glass of water. That's going to stimulate their vagus nerve. Then I can challenge their body, like through a muscle test, have them contract muscles. That helps to bring awareness, neurologic awareness, to the test of the vagus nerve. And then we can use a cold laser along the pathway of the vagus nerve to get rid of that facilitation, get rid of that inhibition of the vagus nerve or excitation in the different parts where it is the opposite of its normal function, and then restore normal function. Many people that have CRPS, what has happened is many of their cranial nerves have been facilitated. The nerves that should be excited are being inhibited, so they're not functioning like they should. The nerves that should be inhibited are being excited, so they're not functioning like they should. The problem, you might be asking yourself, well, how can I tell if I have some type of neurologic issue with my cranial nerve? In Western medicine, there is no test that can specifically tell the difference between someone that has permanent hearing loss, and someone that just has the nerve turned off through an inhibitory signal. And because of this, MDs don't look for it. They do very basic, and other healthcare professionals besides MDs, they do very basic functionality tests of those cranial nerves. So they might have you smell something. If you can't smell it, there's no smelling aid that turns on your nose. So they go, sorry, you've lost your sense of smell. If someone has a hearing issue, yes, they can give you a hearing aid. If they have a vision issue, they can give you glasses, right? So there are some cranial nerves that we can artificially override their loss or diminished function. But most cranial nerves, there is no outside support system. But what I found is if you test that nerve, find that it isn't functioning like it should, treat it specifically with cold laser in a certain pattern, neurologic pattern, most of the time we are able to turn on those cranial nerves. And because so much of what goes on in our head has a reflex back into the nervous system, back into the body, we can therefore directly influence pain fibers. So we can have people that have CRPS pain, terrible pain in their foot, for example, and restore normal neurologic function of the cranial nerves, and their pain will decrease because our entire nervous system is connected. If any of you out there do have questions, please put it in the comment section, and then Danielle will be able to read it and give it to me. I've got one question already. I'm going to have to pause and read it, but this patient asks or says that her headaches worsen when looking to the right, and the pain goes from the top of the head in the center. So I'm assuming that it is going from the eye to the top of the head in the center, and they want to know what they can do about it. Well, we're involving probably minimally 4 cranial nerves. We're looking, so we've engaged the optic nerve, cranial nerve number 2. Then we are engaging the 3 cranial nerves that have to do with eye motion, right? So that's cranial nerve 3, 4, and 6. I don't have a treatment that I can give you to do, but that is an indicator of some type of neurologic irritation. One thing that you might try to do that could be effective is do the exact opposite. So if it hurts when you're looking to the right, then try all the other ways of looking and see if that makes it either not hurt or give you an overall feeling of like things are calming down. So if straight right hurts, then try straight left, try looking straight up, looking straight down, looking up and left and down and left. But each one of those you want to hold for maybe 10 or 15 seconds to pay attention to see if that decreases your pain or gives you an overall sense of more well-being. And if that does, then you can use that for self-help. If that doesn't, then unfortunately it might be something that I would have to address. One more thing that you could try would be looking at something up close, see if that aggravates things for you, and looking far away, seeing if that aggravates or gives relief. So in general, if something hurts, don't do it, and try doing the exact opposite. So I hope that you have found this little talk informational. We love cranial nerves. Besides CRPS patients, I have treated patients that have been born blind and restored their sight, patients that couldn't smell and restored their smell, people that had lost taste and we've been able to restore taste, people that couldn't hear, we've restored their hearing, people that have had like a stroke and their faces collapsed and restore that function of their face because we're upregulating nervous system function. We're testing those specific cranial nerves and turning that on. Of course, vagus nerve every single day, almost every single patient, we're impacting their vagus nerve. Plenty of patients with shoulder issues have a spinal accessory nerve issue. That trap muscle plays an integral role. People that have lost sensation to their face, again, that's the trigeminal nerve, cranial nerve 5. We've been able to restore its normal function in countless patients. So if you know someone that has some type of problem with a nerve in their face or muscle in their face, let them know about what we do, have them reach out. We'd be glad to answer any questions. And I thank you all for being here, and we will talk to you next time. 15 out of 20 minutes.
Yeah, people weren't as interactive, but there were still like 7 people on, so they might just not know